So, Linda, who are the most complex children to assess?
A visual spatial learner, a gifted one, with visual processing issues is probably the most complex child to try to discern, because to test their visual spatial abilities, you have to give them visual items. And so you really have to understand how a visual impairment, a visual processing impairment, is going to interfere with their performance. And you have to put more weight on what they do when they're not in a heavily timed situation. You have to look at what is their performance without the timing. Yes. What is their performance on the verbal part of it? What is their performance when they're not dealing with the way in which they learn, which is holistic,
yes,
big picture thinker, right hemispheric learner, but with vision issues that keep them from showing that on a highly timed visual spatial index, or on picture span, or on the processing speed items, the coding, the symbol search, on figure weights. How is this keeping you from really getting an accurate score? And how can you get around that to try to show people what this child's really capable of doing? They're the most complex. Let's take a look at visual processing issues. These are the common symptoms that we see in the children who come to Gifted Development Center. Difficulty with reading comprehension, skipping lines and losing their place when reading. Many early readers suddenly stopped reading when the print became too small for their eyes to be able to focus. And I have careless in quotation marks because some of these careless errors are simply not seeing the difference between a plus and a minus, or a plus and a multiplication sign. Careless errors in written work, misalignment of numbers, mixing up signs, poor spacing when writing, difficulty copying from the board, putting face too close to paper when writing, and poor at athletics. Tiring easily when reading or writing is yet another one. So again, writing could be a visual processing issue. When I give block design, when any of our testers give block design, they look carefully at the child's behavior. And these are some of the symptoms of visual processing issues that show up just from this one subtest. Many children who have trouble with visual processing use verbal mediation and talk their way through solving the designs, or they solve the problem correctly, but after time limits, and they don't get credit. They don't notice that all the blocks are alike. So they're turning them, trying to find the right block and not realizing that they're all exactly identical. They will often reverse the red and white blocks, or they break configuration, not seeing that it's a square and that they have to create a square. Some of them have difficulty with angles. Some use a trial and error approach without ever noticing patterns. Like if they put two of the red triangles together, it looks like the top of the roof of a house. Moving a block out of its correct position, or saying things like, "That's impossible." Visual, auditory, and sensory issues are much easier to correct than many of the other kinds of issues like ADHD or nonverbal learning disorder that a child might be diagnosed with. And so those modalities need to be checked first.
I then have another question, because I remember you talking about the visual issues that you could see, for instance, in a WISC with the gifted children. And I remember you said something about that tessellation school, which is a school for the highly gifted children, that they send off 80% for vision therapy.
Well, Anne Beneventi does qualitative assessment, gifted
Yes,
qualitative assessment for tessellations.
yes,
And she does all of the assessments of all the children for the school. If she notices vision issues in her qualitative assessment of the child, or she sees discrepancies in anything that is visually presented, then she sends them to a vision therapist for an evaluation. And I don't remember whether it was 80%, but I don't think you're very far from it. If that's what you heard Anne say, that's probably true.
yeah. Well, the thing is that we send off approximately 22% of the children who arrive at the institute. We send them for vision therapy. Does that sound insane to you? Does that sound as a large number of children?
Not at all. I would say at Gifted Development Center, we send many more than that. I would say 50% of the children who come into our center for assessment are sent to vision therapy.
Okay.
So 22% is probably half or less than the percentage of children that we send for vision therapy. And when parents see me, I do a lot of parent presentations. And when parents see me at a conference years later, they come up to me and they say, the best recommendation you gave us,
Yeah.
and we often give 25 recommendations, was vision therapy. Now my child is a reader.
Yes. It's the same thing we experience. So thank you for that.